let us talk about rubella virus. Okay, this rubella virus comes under the category of a virus called as toga virus. All right, guys. What is the other name for rubella virus? It is also called as German measles. It is also called as German measles, or the other name is 3-day measles. Now, some students get confusion when it comes to the other names of rubella and measles. Okay, rubella, the other name is what, guys? As I said, it is German measles. The actual measles, okay, is also called as rubiola. Okay, this is where the students get confused. Once again, German measles is called as rubella, okay, and the measles is called as rubiola. All right. Let's talk about the mode of spread of rubella, guys. It is via nasal or inhalation. Okay, it is due to inhalation of the virus. It can also be transplacental. It can pass from the mother to the child. Okay, if the mother gets infected during her pregnancy, this virus can be transferred to the child also. What is the incubation period of rubella, guys? It is about 14 days. Now again, students get confused or difficult to learn the incubation period of mumps, measles and rubella. Okay, so I have a code for it, guys. Remember the MMR vaccine, right? Measles, mumps and rubella. Remember the incubation period of these are, this is 10 days measles. For mumps, it is, see, with the 10 you put a line like this, it is 19 days. Okay, now you draw the same, you just write 19 here and draw a line here, so this becomes 14 days. So measles, mumps and rubella, the incubation periods are 10 days, 19 days and 14 days. That's how you remember it. So as I mentioned, for rubella it is what, guys? It is 14 days. That is the incubation period. All right. Now let's talk about the clinical features of rubella, guys. See, the child presents or the adult can present with upper respiratory tract infection along with lymphadenopathy of the posterior auricular region, that is behind the ears. He will have the lymph nodes enlarged and he'll also present with upper respiratory tract infection. What about the rashes? I'll show you the rashes picture. Okay, rashes last for about 3 days. Okay, that is why rubella is also called as 3-day measles. Okay, and these rashes are very similar to the rashes that we see in measles, guys. Okay, that is why rubella is also called as what? German measles. Okay, now is rubella teratogenic? Yes, rubella is teratogenic. That means if the woman is infected during her pregnancy, she can pass this virus on to the child. Now, which trimester of pregnancy is said to be most dangerous? If the woman gets infected during this trimester, it's going to be very dangerous and it's going to affect the child very severely. That is the first trimester. It is a first trimester, guys. Okay, now this is how the rashes look like, okay, in rubella. See the rashes, see. Now if the lady gets rubella during her pregnancy, the child is going to get something called as congenital rubella syndrome. Okay, congenital rubella syndrome is very important topic. If a child gets this syndrome, the child is going to have 3 features. It is a triad. This disease is a triad, guys. It consists of PDA, that is patent ductus arteriosus. I'll tell you in detail what it is in subsequent classes. As of now, just remember that the child is going to have a cardiac abnormality. Okay, that is called as patent ductus arteriosus, and the child's ear is going to get affected. That is, the child will have hearing loss. And which kind of hearing loss? It is sensory neural hearing loss. So again, about the types of hearing loss and all, I'll take in some other classes. Just remember, as of now, just mug it up. Okay, the ear is going to be affected, the child's ear is going to be affected, and the child presents with hearing loss, sensory neural hearing loss. And then the eyes are going to be affected, the child presents with cataract. All right, guys. Now let's talk about the diagnosis. See, diagnosis of any virus will include mostly all of these. We can detect the virus using antigen detection or antibody detection. We can do an RT-PCR. We can, you know that a virus cannot be cultured in the normal culture media. We can culture the bacteria in our blood agar, chocolate agar and all, but then we can't do that for the virus. Okay, for virus we have something called as cell lines. All right, so virus can be isolated and cultivated in cell lines. Now this is a congenital rubella syndrome picture, guys. See, the child has got patent ductus arteriosus, the child gets cataract, and another third feature is actually sensory neural hearing loss, and definitely the child, such children will have microcephaly. Microcephaly means the head becomes small. Alright guys, in very brief about the treatment, see, it is a self-limiting disease. You don't have to, it's not a worrisome disease, it is a self-limiting disease. You just have to isolate the patients and give plenty of fluids. All right, so yes, that's it guys. Stay blessed.